Have you ever felt like your body is working against you? You try to eat better, you try to exercise, you cut carbohydrates, you track your cycle carefully, and yet your period disappears. The weight does not move. Your skin continues to break out, and you notice unwanted hair growth or hair thinning. It feels confusing, it feels unfair, and at some point many women start blaming themselves. But what if your body is not broken? What if it is responding exactly the way human biology is designed to respond? Because PCOS is not simply an ovary problem. And for most women, it does not even begin in the ovaries. So where does it actually start? Today we are going to break this down clearly and scientifically. I'm Dr. Mamona, a physician dedicated to evidence-based women's health. On this channel, I simplify hormone science so you can understand what is happening inside your body without fear, guilt, or misinformation. When you truly understand the mechanism, everything begins to make sense. PCOS stands for polycystic ovary syndrome, but the name itself is misleading. Many women diagnosed with PCOS do not actually have true ovarian cysts. The diagnosis typically requires 2 out of 3 criteria: irregular or absent ovulation, elevated androgen levels, and polycystic appearing ovaries on ultrasound. This means PCOS is not just a period problem. It is a hormonal and metabolic condition that affects multiple systems in the body, including insulin regulation, fat storage, skin health, hair growth patterns, ovulation, and even mood stability. When we reduce it to simply a reproductive issue, we miss the bigger picture. In up to 70–80% of women with PCOS, the primary driver is insulin resistance. Insulin is a hormone that regulates blood sugar, but it also communicates directly with the ovaries. When insulin levels remain elevated for long periods, the ovaries respond by producing more androgens, such as testosterone. Elevated androgens interfere with normal ovulation. This leads to irregular cycles, acne, unwanted facial hair, hair thinning on the scalp, and difficulty conceiving. So instead of asking, "What is wrong with my ovaries?" the better question becomes, "What is driving my insulin levels?" Once you understand this connection, the symptoms are no longer random. They are predictable biological responses. The rise in PCOS diagnoses is not accidental. It reflects major lifestyle and environmental shifts. Modern diets frequently include high glycemic, ultra-processed foods that cause repeated blood sugar spikes. Over time, cells become less responsive to insulin, and the body compensates by producing more. Chronically elevated insulin stimulates androgen production and disrupts ovulation. Chronic stress is another contributor. Elevated cortisol raises blood sugar, which increases insulin, which in turn increases androgen production. The body prioritizes survival over reproduction during prolonged stress, so ovulation becomes irregular. Sleep deprivation also plays a critical role. Consistently sleeping fewer than 6 hours per night reduces insulin sensitivity, increases hunger hormones, raises cortisol levels, and disrupts metabolic balance. Even short-term poor sleep can worsen PCOS symptoms. Low-grade chronic inflammation, often driven by ultra-processed foods, sedentary lifestyle, and excess visceral fat, further worsens insulin resistance and hormonal imbalance. Additionally, exposure to endocrine-disrupting chemicals found in plastics, certain cosmetics, and food packaging may interfere with hormonal signaling over time. Finally, there is a genetic predisposition in many families. However, genes alone do not explain the rise. Genetics may create vulnerability, but modern lifestyle factors activate that vulnerability. Now let's talk about what truly improves PCOS at the root level. The foundation is improving insulin sensitivity. This begins with stabilizing blood sugar through balanced nutrition. A high-protein breakfast, ideally around 25 to 30 grams of protein, reduces blood sugar spikes throughout the day. Carbohydrates should be paired with protein and fiber to slow glucose absorption. Reducing ultra-processed carbohydrates and increasing fiber intake to approximately 25 to 35 grams daily significantly improves metabolic control. Strength training is particularly powerful because muscle tissue improves glucose uptake. Engaging in resistance training 3 times per week enhances insulin sensitivity and supports hormonal balance. Unlike excessive cardio, strength training builds metabolic resilience. Daily movement also matters. Walking after meals, even for 10 minutes, reduces post-meal glucose spikes. Aiming for 7,000 to 10,000 steps per day supports overall metabolic function. Sleep optimization is equally important. 7 to 9 hours of consistent quality sleep improves insulin sensitivity, regulates cortisol, and supports ovulation. Sleep should be treated as a core part of treatment, not an afterthought. Stress regulation is often overlooked but essential. Chronic activation of the stress response disrupts hormonal balance. Incorporating breathing exercises, mindfulness practices, social connection, or spiritual grounding can help regulate the nervous system and support ovulatory function. For some women, medical therapy is appropriate and beneficial. Medications such as metformin improve insulin sensitivity. Myo-inositol has evidence supporting its role in improving ovulation and metabolic parameters. Hormonal therapies and ovulation induction medications can be used strategically, depending on individual goals and symptoms. Treatment must always be personalized. One of the most damaging myths is that PCOS equals infertility. This is not accurate. PCOS primarily causes irregular ovulation, not permanent infertility. When insulin resistance and hormonal imbalance improve, many women resume ovulation naturally. With appropriate medical support, fertility outcomes are often very good. The key is understanding that the body is responding to metabolic signals. When those signals change, reproductive function can improve. PCOS is not laziness. It is not a lack of discipline. It is not a personal failure. It is a complex interaction between metabolism, hormones, stress, sleep, environment, and genetics. When you shift the internal environment of the body responds. Understanding replaces guilt. Strategy replaces frustration. Science replaces confusion.
Thank you for watching. For more clinical insights into your wellness, subscribe to the channel. My verified credentials are listed in the description. Stay healthy.